risk 150 to 1, but we don't know that to be true. So we're looking for someone to come in and evaluate our operational processes.
Rush is a fabulous place for a master's program in healthcare administration. We have everything under one organizational structure, one management team, and we integrate from the very beginning the educational experience with the culture and the management of the overall organization. There's nothing like it.
Health systems management trains the leaders of the future, and quality is the common denominator between education and clinical practice, quality in education for the students we serve, and quality in practice for the patients we serve.
We are a true practitioner-teacher model where our practitioners, many of our classes, if not all, are having at least one practitioner coming in and teaching in the classroom. So you already have that integration happening, which is very difficult to achieve in a traditional academic environment.
Since I've been at Vizient, I've literally presented at and worked at hundreds of hospitals across the U.S. And so I've been able to capture and to see how improvement gets done, the barriers to performance improvement, the enablers to performance improvement. And so not only does that information get translated back to our members at Vizient, I also bring that into the classrooms.
As adjunct faculty, as part of the data management course, I partner with a couple other people from our quality improvement team, and that's actually one of the first courses that the students take. We're teaching them using actual real quality improvement data sets that we have here at Rush, and get them introduced to how to handle data and use Excel and things like that. And so that prepares them for their internships as they go out to the different departments throughout the area.
They could start arranging to get beds for patients and make room so we're not holding them down in the ER. So we call it like door to discharge. Let's go. Now we're going to go into pod C.
My master's project was focused on predicting readmissions in the emergency department based on data about the patients that we had. Being able to predict a readmission would allow us to connect patients with the resources they need at that first visit, and also improve throughput and capacity in the emergency department by reducing the number of visits, and particularly unnecessary visits.
So I've been teaching a Lean Six Sigma course here for about 6 years now. We try to make it project-based, and with that we're bringing real-life projects from the hospital into the classroom for the students to participate in and to help lead and drive some of the improvement work here in the organization. What we're always focused on here at Rush is really trying to improve our patient-centeredness, and as a part of that, trying to improve our patient safety and patient quality. And as a part of that, these projects kind of fit within that umbrella of trying to drive improvement in those areas.
What I most enjoyed about the Health Systems Management program at Rush was my hospital operations class, mostly because I could take what I learned about process improvement and all the toolkits that my professor provided us, and I think that it's made me more confident that's something I want to pursue in the future.
The students are benefiting immensely with this. The medical center or our sponsors are also getting benefits by sponsoring the project and getting the consulting work around it. And the faculty also are basically learning and trying to be at the cutting edge in their own fields.
The mission of healthcare at Rush University includes educating our students in context, in the site, in the clinic. Therefore, we need the leaders of clinical operations to work closely with us to assure the best experiences for students, and that's why students come to Rush.
When I graduated and started working in my current role as a division administrator, I just felt so prepared and felt like I could really hit the ground running because I had so much knowledge and background, but I also had a good sense of how to apply it in that everyday world.